Okay, so let's talk a little bit about periodontal surgery, sort of what you can expect afterwards and things you can do to help the healing process after you've had the procedures done. So after periodontal surgery, even though most of the time we try to keep it as small as possible, you're still going to feel some pain afterwards. I'd say the pain's probably the worst for the first 1, 2, maximum 3 days. Unless additional procedures like extractions and bone grafting and stuff like that is done at the same time. Then it may be a little bit more, or maybe last a little bit longer. So I would expect the pain to sort of decrease after day 3. Swelling, very similar. Although hopefully you have minimal swelling associated with the periodontal surgery. Usually the swelling is going to come from other procedures that involve extractions and bone grafting and stuff like that. So yeah, swelling for the first couple of days, maybe 3 days tops, and then goes down after that if you do have any at all. Bleeding, I would expect you to bleed for the first 24 hours and it should decrease after that. Maybe a little bit still day 2. As far as bruising goes, I wouldn't expect you to bruise normally from periodontal surgery unless additional procedures were performed like extractions and bone grafting, or if we tried some sort of regeneration somewhere. But most of the time you shouldn't see bruising. If you do, it's going to show up anywhere between 2 and 3 days after surgery. Lasts hopefully no longer than 7, unless you're a bruiser, and sometimes it lasts a little bit longer. Hopefully that's not the case. As far as sutures go, most of the time we're going to use sutures that don't come out on their own, which means my office is going to take them out for you. We usually do that about 14 days after the procedure is done. So that's pretty much all the things that you can expect. Things that you should not do. Absolutely no rinsing for the first 24 hours. You can brush your teeth and you can floss your teeth, but nowhere near where surgery was done for the first 24 hours. Try not to spit or suck through straws or touch the area for the first 7 days after it's done. If regeneration was done, try not to rub that area or apply any excess pressure. Movement of bone graft materials or regenerative materials decreases the quality of the healing you see afterwards. Absolutely do not smoke or drink alcohol for the first 3 days after the procedure is done. You know, chances are if you were a smoker and you're having this procedure done because you have periodontal disease, a lot of that periodontal disease was, well, I don't know if I can say a lot of it. Let's just say smoking probably had something to do with the reason the periodontal disease has gotten as severe as it is. So if you could quit that altogether, you'd heal a whole lot better. Do not exercise for the first 5 days after the surgery is done. Do not eat hot foods or drink hot beverages for the first 14 days. Strictly cold for the first 24 hours, and then you can move to warm foods and warm drinks after the first 24 hours up until day 14, and then you're probably safe at day 14 to kind of eat hot foods. Don't burn yourself though. I think that's kind of self-evident. All right, so no spicy foods either. No chips, no popcorn, no carbonated drinks, no acidic beverages like orange juice or grapefruit juice. Yeah, that should probably do it. Your diet should consist, remember, first 24 hours, it's got to be only cold stuff. Protein shakes, nutritional supplements, like the shake supplements like Ensure or something like that. Cold pasta, cold soup, stuff like that. I know it may sound kind of gross, but you got to do that for the first 24 to 36 hours. Then after that, you can switch to warm foods as long as they're soft. Let's talk about maybe pasta, soup, stews, slow-cooked meat, slow-cooked vegetables. Chew only on the side that we didn't work on, unless we did it on both sides, and then just be very careful. Okay, cool. So let's talk about some things that you should be doing after surgery to help improve the way that you heal. If we've placed gauze packs in your mouth, use them for the first 1 hour or so. You can change them every 30 to 45 minutes after that if you have to, but hopefully after day 1 there's really no bleeding at all. Minimal bleeding, excuse me. You definitely benefit from placing a cold pack over the affected area, a little cloth between it so you don't give yourself additional trauma to the area. We've already had surgery. We don't need anything to happen to the outside of your face. Cold packs, 20 minutes on, 20 minutes off, and do this for the first 24 to 36 hours. As far as medications go, I want you to take all of your medications as I prescribe them. The only one where you don't necessarily have to take it would be the narcotic. Sometimes that makes patients nauseous afterwards. So oral hygiene, this is an important one. So remember, no rinsing for the first 24 hours. Then after the first 24 hours, I want you to start rinsing. It's either with the prescription mouthwash, Listerine, or warm salt water. The first two are probably the best though. Place the mouthwash in your mouth for 30 seconds, just bob your head from side to side. Don't vigorously rinse. That may disrupt the flaps or may disrupt some of the regenerative materials that were placed. If you want, you can use a very soft toothbrush and start gently brushing the teeth after the first 24 hours. But you gotta be careful because we don't wanna pull a suture loose or anything like that. So if you're totally uncomfortable, I'm fine with you not brushing the surgical area for the first 2 weeks. We'll take your sutures out, sort of clean you up at that appointment. And then absolutely, under no circumstances, should you use a water pick anywhere near the surgery site for at least the first 2 months after surgery was performed. Okay, we already talked about diet, that's good. Okay, the long run. Okay, so periodontal disease is one of those things where you can't actually ever cure it. You can only slow it down until it pretty much doesn't exist anymore. So that means everything that you do after the procedure is incredibly important to maintain the results. So directly after surgery, there'll be that 2-week window where you're healing. We'll take your sutures out at 2 weeks. Then 2 months after the procedure was performed, we're gonna wanna reevaluate, which means we're going back in and we're probing and measuring the sites to make sure we've decreased the pocket depths. The only exception to this 2-month time frame is if regeneration was performed with either bone graft materials, membranes, or biologics like enamel matrix derivative. If any of those were placed, we're gonna wait a solid 6 months before we reevaluate the area. But like I said before, I mean, even though we did surgery and we removed all the calculus plaque and byproducts underneath your gums, you're not done yet. This thing could come back. So it's imperative that for the first year after your surgery, you come see either my office or the referring dentist's office for what we call 3-month periodontal maintenance appointments. We do it every 3 months, and it's to maintain the results that we just were able to achieve with surgery. It's an investment, and I know that you want to make sure that what we did worked. You've put money into this, and we both put time and energy into this. We definitely want it to work. So that means routine periodontal maintenance appointments every 3 months for the first year. And more than likely, most of my patients end up staying on a 3-month routine maintenance recall appointments for the rest of their lives. But it doesn't just stop there. I mean, your oral hygiene at home has to be very good. That means, you know, you got to brush and floss every single day, and we'll go over the specifics of that at your appointment. But it's really, really critical that we keep these areas clean, or this thing could come back and you could be looking at this periodontal surgery all over again. Okay, so hopefully that gives you some good information on what periodontal surgery is, what you can expect afterwards, and then how you can maintain the results that we've achieved over the long run, hopefully the rest of your life. And with that, I think that pretty much sums it up.